after you've done this a number of times, you get to a point where you feel like I just can't go any farther. But we got good manipulation out of her without breaking any bones.
And how many times in February, March did you put her under general anesthesia? Twice for purposes of that manipulation?
We did it once, but the second time we did, we were going in to take out the plates and repair a tendon that had started to lag.
What was your plan and what was Abby's duties for purposes of your treatment between that time, February, March, up until October of 2023? What was she supposed to be doing, and was she doing as far as
she was aggressively working with occupational therapy to work on range of motion and strengthening.
And what's the difference between what they're doing and what you did under general anesthesia, the manual manipulation?
It's similar. We know that the scar tissue fails by what we call fatigue failure. In other words, if you take a paper clip and bend it once really hard, you're unlikely to break it. But if you sit there and just bend it back and forth, back and forth, back and forth, ultimately that paper clip will break. The scar tissue does the same things. The more you can get them to move, and frequently I'll tell patients with this type of problem, you're reading a book, watching TV, I just want you to move and move and move and move. The more they're moving, the better they have of breaking up that scar tissue.
Now, my memory from looking at the surgery from this March 16th, there was something regarding the tendon itself pulling apart. Do you remember that?
Yeah, so
tell the jury what that means and what it meant for Abby.
So, Abby, the tendon that extends your fingers to be able to bring them up, the tendon to the middle finger had done what we call attenuated. In other words, a tendon has got a bunch of collagen fibers that are all hooked together. It had slowly pulled apart and was longer. So when Abby would try and raise all of her fingers, there would be a sag in the middle finger. So what we did is when we went in to take out the plates, we brought that tendon kind of back together, and we call plicate it, trying to bring it back, shorten it up a little bit, and then tie it to some other tendons that have the same function to give her a little better extension of that middle finger.
I take it she's not healed at this point in time, but you are still in the process of getting her better and better as best you could.
So Abby's hand is never going to be a normal hand. It's not going to be like her other side. But we've got it pretty darn close, and a lot of it's attributed to how hard she worked with therapy to do that. I mean, you can do a perfect surgery. If the patient doesn't do any therapy, they're not going to get a good outcome. So she's done a lot of work. I think she's done remarkably well with the number of injuries she's had there, but it's never going to be a normal hand.
I take it you did surgery again in October 2023?
I think that's the one where we took.
And that would be MV9?
That's the one where we found the adhesions.
It's on your TV screen, I believe.
Oh yeah, that's the one where we took out all the plates and did the tendon work for the lagging tendon.
All right, so in A, as I'm looking here, all of these plates have been put aside. And are you in the process of taking out the plate on the right?
Yes, sir.
All right, tell me why you're taking out that plate and what's that leave for purposes of bones?
So, if you've got a plate on a bone, and you can imagine this tendon riding back and forth over top of that bone over time, they can rupture. And there's a lot of stuff in there. Those that were sitting right over the tendon repairs. So it made sense to take out the plates at that point in time, especially when we were going to go ahead and do the plication of the tendon.
All right, let's look at B. Same section, same slide. I take it this is the thumb plate?
Yes, sir.
And are the same issues of concerning the tendons rubbing against the plate over time?
Yes, sir.
Could you tell the jury, please, what is Abby's hand like now 10 months post-surgery once you've removed these plates? What is the condition of her the hand?
The bones are still healing. They're not healed up all the way, but we have seen union of the middle finger. But she's still got pain with motion. Still a lot of pain is related to the soft tissues.
All right, so tell me, and I think you can go back to the main slide there. Is this your last surgery with Abby?
Yes, sir.
23?
Yes, sir.
And when you saw her in 23, how would you describe her condition?
So she was having pain at the base of, kind of in this region right here. It was hard to tell whether that was from the index finger bone not healing all the way, where there was no joint and we had to fuse it back to the trapezoid, or whether it was arthritis in the base of the thumb.
And why couldn't scans, x-rays, MRIs, whatever, why couldn't that tell you?
Well, we did do a CT scan. It showed there was a clear non-union there, but these are, a centimeter apart, and it's difficult to tell on physical exam which was which.
Tell the jury, please, what does non-union of that bone mean in that area?
There's fibrous tissue in there, and it's not bone that's healed all the way across the fracture.
And how would that affect Abby in using or trying to use that hand with regard to pain or discomfort when there's a non-union of a joint?
When we tend to have non-unions, it's painful. Moving things with non-unions causes just a tiny bit of motion at that area, and the tissue around the area is what causes the pain. And so anytime you use that, you feel some pain.
Now, did you decide to do something with regard to this area of her body with regard to a future surgery?
So I would have been happy to just bone graft the non-union. However, I don't do base of the thumb arthritis surgery. That's really a surgery that's done by hand surgeons for arthritic conditions, just like a joint surgeon does knees and hips, a hand surgeon does base of the thumb arthritis. So at that point, I felt that the best thing to do would be to send them to somebody that could treat both of those problems if both of them needed attention.
Once someone went in and opened up the hand, they'd be able to see what the scans may not show and then operate on whether it's arthritis or something else.
Yes, sir.
Did you have a doctor in mind when you did that?
So there's a doctor up in Richmond, Dr. James Stewart, who's widely recognized as he takes on a lot of difficult cases and referrals. And so I called him and said, can you take a look at this and tell me if you think it's the base of the thumb or if it's the index finger non-union. I'm happy to do the index finger non-union, but if it's a base of the thumb arthritis, it's something I'd like to have you take care of. And
as far as you know, he performed that surgery in 25?
Yes, sir.
And you have seen his medical report since that surgery? Do you know if he did?
I think I've seen, so Abby would come back and follow up with us, so I see, but I can't recall whether I actually read his op note or not, because I talked with him, I was like, what'd you do?
Right.
So I knew what he did, but I can't remember if I actually read the op report or not.
Now, you already indicated that Abby's hand is never going to be normal,
yes,
like
sir.
her other hand. First of all, let me ask you whether or not all of your opinions today are stated with a reasonable degree of medical probability.
Yes, sir.
And all of your opinions today relate to her being shot on January 6th of 2023, all
yes,
caused
sir.
by that.
Yes, sir.
Now, when you say that they're permanent, what sorts of problems is Abby going to have, even understanding that she had surgery in 25 for the thumb? What sort of permanent injuries does she have now and will continue to suffer?
She'll certainly never have the exact same range of motion as the other side, never the same mobility. We've fused joints. There's more scar tissue in there than the hand that's not been injured. She'll probably have some component of chronic pain over time.
Does age help or hurt an injury like this?
Being young allows your body to be more resilient than if this had happened to you or I, but certainly a devastating injury is a devastating injury.
What happens when she's 50, 60 years old? What does that do to these injuries?
So she'll be at risk for having some of those tendons rupture as they rub over healed bones and things. Tendons may continue to attenuate. She's had some color changes to her skin and things based off of probably some of the nerves that were injured in there.
If I could, Your Honor, could I have the doctor just step down and point out to the jury with Abby's hand so the jury can understand where the surgery is and what's left, and how it looks now and why does it look so different?
Any objection to that?
No objection, Your Honor.
All right. Be careful, step down. Ms. Douglas, if you wanted to step up, that's fine as well.
But Doctor, why don't you do it over here so the jury can see it? I just wanted you to point out what you've done and tell me what the hand.
So first, we look at the back of the hand. So you can see that there's kind of a little divot in the back of the hand. That's where some of the soft tissue is lost. You can see the entrance and the exit ones are up here. If I ask her to move the hand dorsally, there's going to be tightness in there. If I ask her to flex it, there's going to be tightness in there. You don't see a lot of color change now, maybe a little bit darker here, but as her nerves fire, they can cause blood vessels to expand or contract, and that somewhat gives her those color changes. Although this is better than it was, the ability to extend that middle finger all the way is not perfect yet. We can make it up. And so you can do the other side as well. So certainly see that she doesn't have the ability to bring the fingers down all the way. Then you can see on the inside here where we did the surgery there, that's where we do a carpal tunnel surgery and remove that. There's certainly, if you can compare both sides, there's a lot of thickening in there where there's scar tissue. And if you bring your fingers and spread them apart, she doesn't have the muscles that spread her fingers apart are called the interosseous muscles. She's not able to fire her interosseous. Don't bring the fingers all the way apart like she has on the other hand.
What about strength?
Oh, so grab both my fingers here. Just grab your bowl and squeeze as hard as you can. This side would be considered normal. This is less than half of what I'm feeling on this side, and I think some of the occupational therapy we'll get some strength testing, but I don't recall exactly what those were.
Sitting here almost 3 years after the shooting, do you believe that she's going to get that range of motion or strength back to any significant degree from where she is today?
Sorry, sir. She may make some slight improvement, but I don't think she's going to make drastic improvements in half her hand like the other hand.
Doctor, you can take the stand again. I'm not certain that I have left anything out, but I want to ask before I sit. If I could for 1 second, Your Honor. Please answer any questions that counsel may have of you. Thank you very much for your time.
Yes, sir.
You want this?
Oh, no. Dr. Anderson, just a few questions for you.
Yes, ma'am.
So your last surgery was in October of 2023.
Yes, ma'am.
And are you aware that a few months later, Ms. Zwerner started cosmetology school?
Yeah, I didn't know how long after that she started it, but I know that one of my appointments we talked about that.
And are you aware that she completed cosmetology school from January 2024 to January 2025?
I did not know that she completed or graduated, but I knew she was in it, and she
And had no
seemed-
objection to her going to cosmetology
No,
school?
no, ma'am.
And were you aware that she has become a licensed cosmetologist in the Commonwealth of Virginia?
I did not know that she's become a licensed cosmetologist, but congratulations to her.
Congratulations. And Dr. Anderson, do you, in your course of treating Ms. Zwerner, do you recall a time where she contacted you and asked you to backtrack and write work notes for the past 2 years?
Yes.
Tell me about that.
This happens all the time in clinic when people have had some injury and now they're looking to get back into doing things, and there's, maybe we didn't do that in the past, and at some point in time when she's not working and we don't give them a work note, we have to go back and amend work notes, not infrequently.
Okay, so you had not done work notes in real time for Ms. Zwerner for the past 2 years?
I don't recall, quite frankly. I'd have to go through my notes and say whether or not we did or we didn't. It's not something that I usually do. It's something that when you take care of an injury like this, there's a large number of people that are helping take care of things. We have medical assistants in the clinic that frequently do that stuff for us, and then I'll sign it. But I oftentimes, if we miss it, we have to go back and do it later.
I'm just asking you, Dr. Anderson, do you recall backtracking a work
Yeah,
note?
yes.
You backtracked a work note?
I know we had to do work notes to make up for time that we didn't have work notes previously.
Thank you, Your Honor. Thank you, Dr. Anderson.
Yes, ma'am.
I promoted you to a judge.
I'm not sure that's a promotion.
I want to follow up. After you do these different surgeries that we've talked about, what do you do with her hand? Is it wrapped? Is it a cast? What is the condition which leaves the OR or the hospital?
So usually we put it in with dressings and a splint, and that splint needs to come off fairly quickly, because usually if you left something in a splint for 6 weeks, it's just going to get stiff again. So like when we're doing manipulations under anesthesia and we're trying to get the tendons to move and things, we'll put it into a splint just to let the soft tissues heal, let the wounds heal, and then start range of motion usually around 2 weeks.
Did you want her to be careful about the use or damage to that hand post-surgery?
Yes, sir.
I have no further questions of this doctor.
Any follow-up based on that?
No, Your Honor.
Dr. Anderson, thank you very much. I appreciate your time.
Is he free to go?
He is free to go.
All right, you are free to go. You're excused from court. Just please don't, because the case is still ongoing, don't talk to anyone about it, okay? All right, thank you, doctor. All right. We are ready for the next witness?
Yes, I'm ready for Dr. Stewart. Dr. Anderson just testified and says you take on all the hard cases.
Challenging.
Could you tell the jury, please, a little bit about your medical education background?
I went to medical school in Norfolk, Eastern Virginia, and Army scholarship, and trained as a surgery intern in El Paso, Texas, at William Beaumont Army Medical Center, and did my orthopedic surgery residency at Walter Reed Army Medical Center, and subsequent hand surgery fellowship at Walter Reed, and served 4 more years in the Army. Retired in 2021 and came to Richmond, Virginia.
How long have you been doing orthopedic surgery?
Since the residency, close to 30 years.
Your Honor, without going through more, I tender the doctor as a specialist orthopedic surgeon.
Any objection?
No objection, Your
All
Honor.
right, thank you. He's qualified as an expert in orthopedic surgery, is that correct?
Dr. Stewart, I'm going to try to narrow your testimony because Dr. Anderson took us all the way up to when he referred Abby to you.
Yes.
And I take it that you took her under your care at the advice and recommendation of Dr. Anderson because of a particular problem with her thumb?
Yes.
All right, I'm going to show you, first of all, MV10, which is a medical illustration, which I believe I had sent to you, and ask you if this would help for you to describe to the jury what you did.
Yes.
All right. Your Honor, permission to publish MV10?
Any objection?
No objection.
All right, once again, demonstrative.
Yes, Your Honor.
All right.
It's on your screen, Doctor, and if I can point, and I'm going to look at slide A first. First of all, as we're looking at A, tell the jury what you found when you went in initially to look at Abby Zwerner's hand. I think if you had to open her up besides
Sure.
scans.
Well, what I expected, which was an unhealed bone in her left hand with a defect.
And what kind of defect?
We call it a non-union, where the bone did not heal.
Now, Dr. Anderson had indicated that she was having some pain in that area of the hand, and he wasn't certain whether it was arthritis or it was a non-union or what, which is
Correct.
What is it that you found, and what would you describe the reason that she was having pain in that part of her hand?
My initial evaluation, I was more impressed with the pain in her thumb joint, which is just underneath that device with the bone graft, even though she had movement of the non-union in her left hand. And I tried a cortisone injection to the joint right next to that area to see how she would do for therapeutic and diagnostic reasons.
And how did that shot help or hurt?
She came and saw me a few months later and said it helped for about a week or two and had moderate relief. But at that time also her complaints and exam findings were more consistent with a symptomatic non-union or the problem there at that metacarpal in her left hand.
Do you know when you first started seeing Abby? Was
Yes.
that at the beginning of 25, or when was it?
That was December of 2024.
And is that
almost
when-
2 years from the time of injury?
Gotcha. Is that when Dr. Anderson had referred her to you?
Yes.
All right, so I take it you attempted to perform surgery to try to relieve this pain? Is that what we're looking at in April
Yes.
14th of 25?
This illustration illustrates the surgery that I recommended, which is a repair of the non-union using structural bone graft from her pelvis.
All right, so let's go to B, please. Dr. Anderson had indicated that he had taken a pelvis bone. Did
Yes.
you have to do the same thing?
Yes, from her opposite side.
So you went into the iliac crest on the other side?
Correct.
He described her moving or chipping away the bone, putting it
Your Honor,
aside.
I'm object to the leading.
Go ahead and tell us what you did on the iliac crest on the opposite side. I apologize.
Objection is sustained. Now you can.
I'm going to rephrase it. You tell us what you did with the iliac crest of the right side.
So this type of problem requires good bone graft, and it's typically from the patient. We call it autogenous. And the iliac crest has probably the highest quality bone graft. And you basically remove a section of bone from the iliac crest or pelvis. And her original bone graft donor site was on the left, so I went on her right side to get that.
And where did you place it?
I placed the bone graft after cleaning up the non-union site in the space, and it measured about 1.5 centimeters or so in length to fill the defect.
And when you say it measured, is that the gap size for the
gap
non-union?
size, once it was cleaned up, the non-union and the devitalized tissue, yes.
All right, so what are you doing here in B of MV10?
You can see the bone graft, that little trapezoidal area of bone at the base of the metacarpal, and then the plate and
that right
screws.
there?
Correct. And the plate and screws are being used to stabilize the bone to allow it to heal.
Now, if my understanding is correct from earlier testimony, Dr. Anderson had a bone graft, a piece of like this before?
I think it was mostly cancellous, but I'd have to go back and look at his operative report, which was from the iliac crest.
And what is a cancellous?
Well, you have two types of bone, and one is cortical, which is the hard bone that we all see, and then inside that bone you have cancellous bone, which is in the medullary canal.
And so
it's
what was-
spongy.
And what was the purpose of this plate here?
To stabilize the structural corticocancellous bone graft inside the defect to allow that bone to heal.
Back up to the full picture of 10, MV10. All right, looking at the far right, the post-operative surgery. So you did surgery, on April 14th?
Yes,
25?
yes.
And if I'm not mistaken, the x-ray that we're looking at the
Objecting
far
to
right
leading
is
again.
dated when?
Bleeding. Can,
I'm asking when is the date of the x-ray on the right side?
So sustained is the first part of the question. Now the second part. Go ahead.
I'll rephrase it, Your Honor, I don't want to. When is the x-ray taken on the right side of this diagram?
Well, according to the diagram, 5 August 2025.
So that's just a couple of months ago?
Correct.
Tell us what we're looking at, what do we see?
What you see is the plate in place and the bone graft, and at that visit, I felt as though there was some evidence of early consolidation or healing. These can take upwards of 6 to 12 months to be completely consolidated.
As we sit here now in October of 25, is that plate still in Abby's hand?
It is.
Do you believe, first of all, do you have any idea as we sit here whether you'll be able to take out that plate and win?
Yes, and I've spoken to her and will probably recommend taking that out within 6 to 8 months. She still has a fair amount of pain over that area, which I think is related to the plate and the screws. So probably within a couple or 3 months, we'll get a CT scan to assess for complete consolidation and then subsequently plan on removing the implants because they are so close to the skin.
Do you believe that Abigail Zwerner's injuries in her hand as a result of this shooting on January 6th are permanent?
Yes,
Do you believe that your testimony and your opinions today are based on a reasonable medical probability?
yes.
1 second, Your Honor. I have no further questions. I appreciate you giving us your time.
Thank you. Any cross-examination?
Just a few questions. Dr. Stewart, are you aware that during the course of your treatment of Ms. Zwerner that she's completed a 1-year cosmetology program?
Yes.
And you know she's a licensed cosmetologist in the state of Virginia?
Yes, it's reflected in my notes.
And you don't have any objection to that, Your Honor?
No.
You don't? Thank you.
Any follow-up based on that? Okay, thank you very much.
Thank you, Doc. I'm sorry I came this far for that little bit we needed.
It's okay. Thank you very much.
Thank you very much, Doctor. You are excused and released from your subpoena, but I would ask that since this case is still ongoing, you not talk about the case.
Absolutely.
Thank you, sir.
He's released from our screen.
All right, very good.
Thank you, Dr. Stewart. Appreciate it.
All right.
Short break for our next witness.
Okay, and that's going to be... Okay, all right, very well.
Thank you, Doc. Appreciate it.
All right, we'll go ahead and take a 10-minute in real-time break, 15-minute in lawyer time break, and we'll be back. Have Deputy Hopkins come get me, all right? Thank you.
Watch your steps after that. Thank you, Doc.
May it please the court. Good afternoon.
Good afternoon.
Can you go ahead and introduce yourself to the jury?
Hi, I'm Hannah Zwerner. I'm Abby's twin sister.
And Hannah, I am going to show you a roadmap that I promised you. And if we can publish this to the jury. Oh, it's an old one. It's not the right one. Always technical difficulties. Well, that's up. How are you today?
I'm doing okay. How are you?
Good? You a little nervous?
Yeah.
I know that you were planning to testify tomorrow and made it over here today, so thank you.
Yeah, of course.
So, we've got a roadmap in front of you now, and this is just the 3 buckets of stuff we're going to talk about, okay?
Yeah.
And I drew 2 roads because the 2 of you kind of twinned together and you started. And then we're going to talk about growing together, and then we're going to talk about life today, okay?
Yeah.
Ready?
Mm-hmm.
All right. So, natural question for twins. Who was first? Who was second? I heard Abby's the middle child, so tell us about that.
Yeah, Abby is 8 minutes older. We do like to joke that, well, I joke it was the best 8 minutes ever, just stretching out before I was pulled out into this world. So she is 8 minutes older, but I am a couple inches taller.
And that's your balancing
Yeah.
between the 2 of that.
Yeah.
And growing up, were you the type of twins that dressed the same? Mom put you in the same clothes to school, or how did you guys handle that?
I can confirm there are pictures of us when we're like toddlers dressing similar. However, when we grew up, I really wanted to dress alike. I don't think I understood that there's a difference between identical and fraternal twins. She did not want to dress the same as me.
And as you were growing older, you also had an older brother.
Mm-hmm.
And your older brother, as we learned, was 16 months older than you all.
Yeah.
Your Honor, I just object to the relevance of this.
All right, can we move on?
Sure, Judge.
All right, thank you.
And during those times growing up early in life, did the 3 of you grow a bond together where you could understand who Abby is as a person and how she changed through the years?
Yeah, I mean, we've built a lifetime of memories together. We're very close. I think she's even more than my best friend. She's my sister.
And as you all grew older through middle school and high school, tell me about your desire to stay close to Abby and Abby's desire to make a name for herself.
I think I always wanted to be more like Abby. If she did something, I wanted to do it. But yeah, as we got older, you kind of want to figure out who you are. So while we are very similar, I think we're different as well.
And when it came time to choose where to go to college, had you all gone to school together up until that point in time?
Yes.
And then what was the decision that you all made at the time of college?
I could not go to the same college as her.
And that was her instruction?
Yes.
And where did Abby decide to go?
James Madison, and she loved it there.
And where did you go?
Christopher Newport.
And did you have things in common in terms of sporting teams and things that you liked?
Your Honor, I'm going to again object to the relevance of this.
What is the relevance?
Your Honor, ultimately we're asking this jury to understand the difference between Abigail Zwerner before and after January 6th. In order to illustrate how she, if at all, has changed, we have to first get an understanding of the foundation of the witness to be able to demonstrate her knowledge of the individual, describe what life was like beforehand, and then differentiate those experiences after the fact.
All right, overruled. You may proceed.
Thank you, Your Honor. So, we can go to what's been pre-marked as 90C. And we'll just show that to the counsel. It's already been shown to counsel before, but just in case, Your Honor. You see that up on the screen?
Yeah.
All right. That's a picture of your sister?
Yeah. We were an Orioles family growing up. We went to games, we watched them together, and that's definitely my shirt. Yeah, she's sitting in her classroom. I helped her put some of those things up. She's very particular about the way that she wanted her decorations. Yeah.
Permission to publish, Your Honor, and I'd move it into evidence.
No objection, Your Honor.
That's your jersey, huh?
Yeah.
So, as you all were getting older and she started teaching, she moved back to town, right? Back to the peninsula.
Yeah.
And did you two live together?
Yeah, we did. While she was finishing up James Madison, I was in Florida, but moved back, and we were both teaching at the same time, living together. Yes.
And when you all were teaching, obviously out at work, you'd come back home at the end of the day.
Yeah.
Would you guys spend time together in the living room?
Yeah, every single evening. So I was a high school English teacher. She was an elementary school teacher, and she had like mountains of paperwork. She would hook up to the printer in our living room and print things for lessons the next day. And I just remember thinking, she's so dedicated, and I just never brought work home. That's just, how the two of us were different. Every single evening, she would be on her laptop prepping for the next day. She went to work early. She came back after hours. Yeah, that was our life.
And when she wasn't sitting on the chair in the living room with the printer, what did Abby like to do?
Hang out with friends, go out shopping. She could never sit still. She always wanted to get out and do things.
Was she a book by the fire kind of person on the weekends?
That's me.
And growing up, was that always how she was?
Mm-hmm.
Did you all go to amusement parks like Busch Gardens and things like that as a kid?
Yeah, and Abby was always the one to stay behind, always kind of timid. While my brother and I would, go on the roller coasters, she was fine with the teacups. If we were going to Virginia Beach, my brother and I would go into the water, and she would stay behind, always observant and timid and watching, but always present.
And in your interactions with Abby, as twins or just as sisters, did you two grow to develop an unspoken bond?
Yeah.
Tell us about that.
We can look at each other and know exactly what the other person is thinking. She's agreeing right now, I can tell you that. Yeah, I mean, like I said, when you've been with somebody your entire life, like, I've never been in this world without her.
Your Honor, again, I'm going to object. We're getting far afield of anything that's relevant. Ms. Zwerner's feelings are not at issue here. It's about her sister.
I disagree, Your Honor. I think ultimately we're putting on a case tomorrow about an evaluation, a psychiatric evaluation, and to lay the foundation of the differences and the changes in her demeanor, who she is, how she shows up in this world. Who better than the person who's lived with her their entire life, but 8 minutes?
Right, let's move it along to those topics.
Yes, Judge.
Right.
So, when you spend time with Abby and before this time, I'm going to show you a video. If you can, this is 90D.
What number is it?
90D is in dog. Yes, please. You see that picture of her, or video, I should say?
Yeah.
What does that remind you of your sister before January 6, 2023?
Full of light and spark and just so outgoing and just silly.
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 I'm going to change gears and talk about after January 6th.
Okay.
You said that was silly, full of light. Can you tell us about that light in Abby today?
It's still there. It is very dimmed.
And it's dimmed like what?
She's just not the person that she was. I feel like she's kind of lost her sense of direction in a way. She doesn't want to go out anymore. I don't talk to her as much as we used to. We talked about the unspoken twin language, and I don't know what she's thinking all the time. And yeah, I think that she had a lot to be excited about, and she doesn't anymore. And so that light has kind of dimmed.
And are there times since January 6th where you looked at your sister and you felt like you can't read?
Yeah. She doesn't want to talk about things. She doesn't share them with us.
And in your impression of your sister, is she a people pleaser?
Yeah. She wants everyone to be happy, and doesn't worry about herself, but worries about everyone else.
And when you say she's keeping stuff to herself, tell me what that looks like when you see it in the real world.
Just shutting down, becoming more reclusive, Yeah, it's like a wall is put up between her and the rest of the world.
And before January 6, 2023, did you ever feel like that wall was ever between you and your sister?
No.
Do you feel like there is a wall, however tall it might be, between you and her now?
Yeah, we're working on it, but it's there.
You said earlier that she's sort of reclusive. And we talked before about sort of her demeanor to not be the person to grab a book and sit by the fire.
Yeah,
How has that changed since January 6th?
she doesn't leave the house. It's very hard to get her to go out and do things, and if she does, someone has to be with her. She's really afraid of being alone.
And when she's out and about, because she is sometimes, right?
Yeah.
And you see her, do you see that same light, that same color in Abby that you used to see?
No.
Can you tell us what you do see?
Someone who is scared but trying to be strong for other people.
Is that what you see today?
Yeah. Yeah.
Thank you, Hannah. Those are all the questions I have.
All right,
A few questions.
cross-examination.
You've told the jury that your sister's been more reclusive and withdrawn from the community.
Yes.
You have put your sister out in the community through fundraising websites, haven't you?
Yes.
You created a GoFundMe page,
I did.
and it has Abby's picture on it, correct?
Yes.
It puts her story out in
Yes.
the internet.
That's correct.
And you also have a website to sell T-shirts.
That's correct.
And again, you put your sister's story out in the universe and make her available.
That is correct. It was not without her permission, if that's...
So she allowed that. And you talk about that your sister doesn't want to go anywhere. Have you given your sister any gifts of concert tickets?
I
since
have.
that? And where was that? Did
I
you
drained
take-
my bank account to take her to Taylor Swift.
So she was able to go to Taylor Swift.
Yes.
And that's
And
a-
it was not without its own challenges.
That's a pretty large crowd.
It was.
Where was it?
Philadelphia.
The Eras Tour in Philadelphia?
That's correct.
And your sister was able to go do that.
Like I said, yes, but it was not without its challenges.
Thank you. No further questions.
Thank you.
Any follow-up?
No, Your Honor.
All right, is she excused?
She is, and similar to Mrs. Zwerner, we'd ask that she be permitted to remain in the courtroom if she wished.
Is she under your subpoena, Ms. Douglas, at all?
She is not.
Okay, all right, then you are excused from court. However, you may stay in courtroom to listen. All right, thank you. All right, are you moving 96 and 90D into evidence?
It was 90C and 90D, and yes, Your Honor.
All right, any objection to those two?
No, Your Honor.
All right. Those are admitted. All right.
No other witnesses, early release again.
All right.
We were ahead of schedule, Your Honor. We have 2 witnesses tomorrow morning on the plaintiff's side
Okay.
that we intend to call.
All right. And then is that who are you planning to arrest after that?
Yes, Your Honor.
Okay. All right. And then will the defense have witnesses ready to proceed in the afternoon tomorrow?
Judge, we are attempting to coordinate some potential witnesses who might be available. That's in the works, and we'll try to provide an update as quickly as possible to opposing counsel.
Thank you very much. I'd like to get as much done as we can because I do want to try to have an early release on Friday for Halloween, get everyone home to either their kids or handing out candy.
Your Honor, I don't think that'll be an issue at all because we certainly won't be able to fill the day on Friday, and I wanted the court's indulgence. We talked about that yesterday.
Okay, very good. I'm not going to recess court. I am going to excuse the jury, however. All right, ladies and gentlemen of the jury, we're going to take our break for the day, and we will start fresh tomorrow morning at